No sound. There. Thank you. How much time? 2 minutes, no sound. Beautiful. Thank you. I'm off of mute. I sure was. I love it. That's one of the things when you go live, right? Anything can happen. So I thank you both for, you know, I tend to be fiddling with stuff behind the scenes. And so I try to mute while the song is going on and I'm prepping, but I got it. Thank y'all. I'm off mute now. All right. So I'm going to go back and I want to say thank you for joining me. For those who are coming here for the first time, my name is Dr. Williams, AKA Queen, and I am a radiation oncologist by trade. And I wear this get up here because I've come a long way. I like to say God has brought me a long way from the Caribbean to being enlisted in the military to lieutenant colonel retired, and I'm a physician. Who but God, right? So I try to share my knowledge because I get pulled different directions from family, friends, friends of friends, friends of family who has basic questions about general health stuff. But I'm just one person. Even though there are a lot more information out there now and people tend to try and get their information, it's almost like a downward spiral where you may look up one thing, but then you have to look up the definition of something else and you're just going deeper and deeper and you're still on the first thing. However, I started doing this because I'm just sick and tired of being sick and tired. Have you ever been there? Right? For me, I'm sick and tired of people who don't know what they don't know. They just don't know what they don't know. And I'm don't like having these folks coming to see me who could have otherwise been helped, right? So I'm a radiation oncologist, which means I use radiation to treat cancer. By the time patients used to get to me, I'm like considered the anchor leg, meaning that I'm the fourth person down. They've already been diagnosed, they've already gone through everything, and now they come to me. And the issue was by the time patients come to me, I found out majority of the time they do not understand what truly their diagnosis is, why they've been diagnosed, what their treatment truly means. So I got into this realm of trying to break down the basics of stuff, and I think that's my gift. I simplify things where anyone can understand. If you're a sixth grade level, seventh grade level, you're going to understand about treatments and cancer screening by the time I'm done. And I think it's because the route that God brought me, right? Because as an enlisted, I wasn't a doctor. I was just a teenager, run up and down in the military, climbing over this, doing that. And so I got to appreciate what it means to simplify things. Today is a topic I'm going to cover that really got me a little bit just concerned because we're going to be looking at cervical cancer. Yes. And this affects a lot of younger people. So it's not that um, it's an older person cancer. It's not that it's somebody who is in their 70s or 80s are getting it, or it's not young teenagers that's getting it either. But it's that thing in between where if you're not aware of what you need to do for screening, then you're going to be missing out on the opportunity of preventing and stopping a cancer in its tracks early. So, without further ado, I don't have a lot of time. So, I want to go through this so that I can get to answer some of your questions as well. So, if you have questions, as you see here, I'm a one man show, y'all. I'm really just doing that because I feel like you need to have this information. So, I'll go by, and this is awesome. I thank you all for joining. It's not too late. Share the link, encourage all the females that you know to join because this is information they need to have if they're in their 20s. And I'm going to start out by saying, hey, listen, I'm going to be going into using anatomy, right? So it's nothing crass, but I will be using the correct terminology of words. So I was one of those parents where my son or none of the kids around me could use wee wee. No, it's not wee wee, it's a penis or it's a vagina, the proper anatomical term. So we're going to be going into this. So if this is something that you're not ready to hear, I'm going to give my disclaimer here that as a physician, I will be using words that are anatomically correct. All right, so let's jump in here and see what we can get going. We are going to first, here comes my disclaimer. The bottom line is that you really do need to check with your physician for everything. This live session is just information that I'm sharing. This is not the end all, be all. I just want you to be able to have this information so you can engage your physician, ask the relevant questions. But sometimes the big thing is you don't know what questions to ask, right? So that's what I'm here to do. So by participating, you're agreeing to release the presenter and any affiliated organization from anything. So I pause here so you can see the medical disclaimer, read it, and know that you are in agreement by continuing to watch. So the other thing is, I have been doing this. So let's see. I've graduated medical school in 2003. And so I've been on this trek for a while. And you've continually sent me questions. And today I'm in session 3. I'm sort of jumping all over, but today I'm in session 3 where the question asked was, can cancer really be caught early, or are those screening just a scare tactics? Like, seriously, are we just trying to scare you in order to get you screened for your cancer stuff? And the answer straight up is no. Nobody's trying to scare you. It's just that when you're diagnosed, if you're diagnosed, there are some things you can do to prevent some of these. So that's what we're going to jump into right now. So without further ado, let's just start talking about today is our 7th for this month. We are going again every other Tuesday. Please do share and join, share the link, either your Facebook or YouTube, wherever you may be, please do share. This will be on as well afterwards. So let me move forward here in doing this talk. Oh, yes. So a dear friend of mine was watching last time we were on the 11th of March, and we did the review. And you can always go back on YouTube and go into the live section, but we did colon cancer screening last 2 weeks ago. And one of the things we spoke about was the screening age. I've been doing this for so long and I have so many old presentation. I pulled some of my presentation up slides, and I stated that if you're African American or African descent, screening should begin at age 45. That remains true. And other general population, or at if you're not at high risk, it's at 50. No, no, no. The American Cancer Society and the U.S. Preventive Service Task Force, they have changed this. And that's why the disclaimer is so important. You are just getting the information to understand the basics. But when it comes to screening, all that stuff changes on a regular, as you will see as we jump more. But I just want to make that correction from 2 weeks ago when I talk about colon cancer screening. Colon cancer screening starts at age 45. And this is one of them that can be just outright stopped in its tracks. All right. So this week, though, we're going to continue with our 2025. You know, whenever I talk about the body, I like to compare it to the car. And everyone have an understanding about the vehicle. And there's a lot under the hood of a vehicle in order to get it running. And your body is much more complicated than that. So there's the brain, respiratory. Last 2 weeks ago, we did GI, there's cardiac. We're now going to jump into the and more portion this week. So stay tuned. I love, love, love to be able to go over different areas. Because again, remember, I'm just trying to make you advocate for yourself, because you're not going to have a doctor like me to go with you everywhere or to be there with you. Yes, I do have some services, but again, I'm just one. So I want to make sure that you get this vital information to advocate for yourself and know how to talk to your doctor and what questions to ask. So, this week we are going to be looking on the basics of cervical cancer. What is cervical cancer? Who is at risk? What is the screening test? What are some symptoms? And, I was very ambitious when I started this, but it's no way I'm going to be able to get to endometrial cancer. So, if you're over 50, endometrial cancer kind of come into play postmenopausally. So I will have a part two, and I will do that the second Tuesday in April. I can't believe March is almost over already. So let's jump right into this here. So these are just some of the things we'll cover. Not enough time to do everything. I always like to start with the estimated new cancer cases as you see up here. Let me just maximize some of this here. I like to start with the cancer cases for males and females. And what's not listed here is cervical cancer, because cervical cancer occurrences has dramatically gone down. And you'll see the stats a little bit later, but it's not in the leading 10 anymore. And these cancer cases does not include skin cancer. It does include melanoma, but the common squamous cell cancer and basal cell that you get on your skin, that is so common that it's not included here. However, I do want you to be aware of what the common cancers are. And we're going to go through, talk about screening. This is not a scare tactics, right? So if you smoked or you've been around smoker, we're going to talk about that and what you need to do to get screening. But let's just go forward from here. The first question that always come up is, okay, doc, yeah, people talk about the cervix and cervical cancer, but in all honesty, where is the cervix? And the first time someone asked me that, I actually pause and I thank them for asking me that question, because sometimes we just take for granted that everybody knows the basic anatomy. So we're going to go through here and we're going to look at where is the cervix, and then we'll get into what is cervical cancer, and I'll answer some of your other questions that you've asked over the past few years, etc. So we're going to look at first things first, where is the cervix? And I'll give my disclaimer again that, hey, this is about science and anatomy. So you're going to be seeing some pictures that I actually went and purchased because I want you to see and be able to use your imagination to say, okay, I get it. I understand where it is and I understand certain things. So let's break this down. Let's jump into this. Where is the cervix? Truth be told, you can't really just see the cervix standing in front of a mirror. It's not something that you can just stand there and see. So it's quite okay that you don't know where the cervix is. It's not the same as saying, where is the nipple areolar complex, or where's the nipple on my breast? You can see that. Right? Totally different. Where is my belly button or my nipple? You could see that, but where is the cervix? You cannot see that. And so when you look at this body, this is showing you from the very bottom. I did not put an arrow there because you know where it is, where the vagina starts. That tube going from the end up. That is where the vagina is, and at the top of the vagina is the cervix. You're like, okay, doc, I don't know what that is. Let's take another look. Now, imagine you cut away at it and you're looking at, okay, so I see. You'll see where it's pointing and showing you where the vagina is. But a lot of people never really stop to think, okay, and you may have done some of this in high school, or you may not have, or you may not have been paying attention. But needless to say, that this is something that you need to understand. And I'm breaking it down from the very basic because I'm going to build on it so you understand the reason why your physician does certain thing. My other disclaimer is I'm not a gynecologist. I don't do this, right? But I am female and I do go through the same evaluation and test. And I do in the past have treated cervical cancer and endometrial cancer. So now you see where everything is located. Let's take an even closer look at where this is. Now imagine you're standing in front of the mirror and you just cut from the center all the way down, right? And that is called, we say coronal, but you just cut down the center. It's like if you have sliced bread, imagine you having some sliced bread and you just cut down a slice of the bread and now you're seeing on the inside. That's what this is. Okay. So now let's take a bigger look at everything. At the bottom here, you can see where it's pointing to say, okay, that's the vagina. And at the very top of that is the cervix. Then you have the uterus and you have the endometrium and everything else there you can see for yourself. Now, it's important to know that the vagina on average, let me see here. Let me make sure I'm talking to you. It's important to know that the vagina on average is about 4 inches in length, which would be about 10 centimeter. And it's elastic, right? So it varies. Now, if the cervix sit on top of the vagina and it's something you can't see, you see where I'm going with that? How can we do the test without you being in that horrible position and using those medieval type of instrument? That's the only way we can actually see that area and get samples. So I want you to keep this in mind. Next week, we're going to be looking at uterine cancer, endometrial cancer for those who are more like postmenopausal. But here we're talking about the cervix. And so it's important for you to know where the cervix is located. So you can't just, for the most part, reach up and touch your cervix or feel your cervix without there being a lot of force and other things. So I'm going to leave it right there. Y'all are grown folks. Y'all are grown folks. You know where I'm going with that. You know exactly what I'm saying. But the cervix is at the top of the vagina. And once you understand that, you won't never ask your doctor, why do you have to use that instrument? Right? Like, why you have to use a speculum? Now you understand why. Okay. When we talk about cervical cancer, I'm not going to go in depth regarding cervical cancer or what it is, right? Because everyone here who's listening and watching, I just know you're going to get your screening done. And so this is not going to be you, right? Needless to say, there are over 12,000 new cases of cervical cancer in the United States per year in the United States. 12,000. Now, that number may or may not seem like a lot to you, but I always tell my patients, I don't care what the statistics says. When I'm treating or talking to you, that statistic is 100% because it affected you, right? So think of it that way for yourself. And not only that, but look at the number of how many die from this disease. I always ask the question in these presentations, if there is something you could do to prevent a cancer from happening, would you do it? Would you? Right? So let's see here. All right, let's see here. So, when you're talking about cervical cancer, if you look at the page, you'll see that there are different areas where the cervix gets affected, right? It starts early. If nothing is done, it then progresses from stage 1 to 2 and more. So, as this says here, this is a cutaway view. At the normal cervix center, you have the opportunity then to try and prevent all of this from happening, right? You can prevent all of that from happening simply by getting screened. And I will jump into this in a little bit as to what screening entails. And most of you do know. And you know what? I was having conversation, and it always happens that the cervical cancer develop when you get too busy and you forget to get your screening, or you didn't have time to go in, and all of these things because you get so busy with life. But ladies and gentlemen, if you're on, talk to your sisters, your aunt, your mother, everyone else. You need to be aware that you cannot not take care of yourself. You cannot change a tire on your car, or you're going to have a blowout on the side of the vehicle. A lot of us take better care of our vehicles than we do our body. And I see here from Miss Peggy, I know I showed up here saying I was diagnosed with cervical cancer. Thank God for early diagnosis. Thank you so much for sharing that. Yes, yes. And you have to get your screening, right? So here is I'm going to go off. I'm going to go off to the deep end for a little bit. Bear with me. As you know, there's been a lot of changes in our community where females are having sex change to become males and vice versa. I want to be sure that as a physician that I address the questions that I've been asked from that community as well. Or if the it's a couple and they're both, homosexual or male or females. So the question is, well, can they get cervical cancer because they're not sexually active with a male partner? And the answer is yes, yes, and yes. Now, if you had a sex change, I do not know in detail what the surgery was. So I'm not sure what they removed, but chances are this is a question you need to ask your surgeon who did the surgery. Do I still have my cervix? Do I need to be concerned about cervical cancer even though I've had a sex change and I am now male? Right? Sometimes people forget those things because I had treated a female who had prostate cancer, was born male, had a sex change to become female, but the prostate was still there and the PSA was going up. But that's for another conversation. That's another one. But I just want to be aware of this and acknowledge that with cervical cancer, this can happen if you have a cervix. And I will go ahead and answer another question that I've been asked as well. I had a hysterectomy. Do I need to have my screening done still? And that, my dear friends, depends. That depends. And I'm going to come back to that. And if I don't, and you've had a hysterectomy, remind me at the end here. Remind me. So let's see here. I have some people saying, good evening. Good evening, Kira. Thank you so much for joining. And I have Denise here. Hi. Thank you. Thank you for joining. Appreciate it. Yes, I got to get this information out here. No sense me sitting on it and sitting in the clinic when y'all out there really need it in a breakdown format. I'm bringing it to you Caribbean style, enlisted style, keeping it real, keeping it real. All right. So just the facts about cervical cancer. I know I try to think I'm cool. Y'all don't put me in that square box because, I got some letters after my name or whatever. I think I'm cool. Let me believe I'm cool. All right. So let's get back about cervical cancer. Cervical cancer is associated with HPV, the human papillomavirus virus. Papillomavirus. See, even us doctors have problem with these words. That's why we come up with the acronyms HPV. Love it. So there are different types of HPV, right? So you can have HPV infection and not get cancer. So there are high risk type of HPV, and then there are the other HPV that the body can take care of. So check this out though. If you have HPV and it's one of the high risk type and your normal immune system doesn't take care of it, there are several different types of cancer you can get from HPV. That's why I didn't understand about this whole thing. Again, that's my bias though. Let me pause and say that's my bias. The HPV and what age and who should get it and when. I'm going to leave that for you and your doctor and your gynecologist and your pediatrician, but I vote get it. If you get high risk HPV, look at all these cancers you can get from it. cancer of the anus, cervical cancer, vulva cancer, vagina cancer, penis cancer, and yes, cancer of the head and neck. What do I mean, cancer of the head and neck? Cancer of the tongue, cancer of the throat. Yes. So let's pause. Sexually active people out there, if HPV is sexually transmitted and you can get cancer in all these locations, well, you know how it get to the mouth. Hello. I'm not going to go live saying that. You know exactly how you get it in the mouth. So there are cancers that you can get just based on this virus, this infection. So what are some of the risk factors? The risk factors for HPV have everything to do with sexual partners. So if you are born female, sexually active, and have multiple partners, then you're at risk for getting these high risk HPV infection. Multiple partners, or if you have a heterosexual relationship and you're with a male and the male has a multiple partners, right? We know this happens. Then the male is bringing it back to you. And again, if you are homosexual and you're two females in a relationship, but either or both of you had relationships elsewhere before, not HPV, is sexually transmitted. It can be in the vaginal area, it can be in the mouth. All right. So the other risk factors also, right? You have dysplasia. So besides the HPV risk, you also have other risk factors. So dysplasia of the cervix, if you have just cells changing, that's why it's so important to go and get those Pap smear tests done, because all of these stuff. And don't ask me. I heard a comedian saying, "Well, how can smoking cause cervical cancer?" I'm not putting. I was like, oh, she funny, but that's just to show you that the poison in that nicotine can, and not the nicotine, but the poison, the fillers can go so many places in your body that it can cause cervical cancer. If you have family history of cancer, sexually transmitted infections such as chlamydia, if your mother had to take DES, was having issues with delivery, and was given a type of drug called DES, you're at risk for cervical cancer. So you can ask, Mom, did you have issues when you were having delivery with me? Did they give you DES? You're at risk for cervical cancer. And if you're having an immune system that's low, if you have HIV, etc., you're at an increased risk as well. Time is getting away from me here. Anyway, so now we're looking at this, that 50%. Now, a lot of my information, because I didn't check last time, this time I went to the gynecologist website and see what's going on. So you could visit that website yourself. It's right up here, acog.org. And I always try to tell folks, when you're swiping left and swiping right or swiping up, whatever swipe way they're doing now these days, take the time to learn something about your body, right? And I know some of you are saying, well, I don't know what to learn or what to look up. Guess what? Now you do. Now you do. Can't say you don't know anymore. And so 50% of cervical cancer occurs among women who never had screening. It won't be any of you anymore. All you're on here, you're going to share it, you're going to make sure folks, and we're going to talk about who should get it too, but it's not going to be any of the lovely folks I have here online with me today, right? Yay. You're going to get screened, and screening include the Pap test and HPV screening. And yes, screening save lives, because it usually takes 3 to 7 years for the high grade changes to become cancer. So it just doesn't happen overnight, lovely folks. It doesn't happen overnight. And that's why screening is so very important, right? All right. So over the past 30 years in the United States, the number of cases of cervical cancer and deaths has decreased by one half, 50%. 50%. So why am I doing that? Because it should be lower. That's just the truth. It should be lower. 50%. when all you got to do is get your screening. It's simple and it's fast. I didn't say it was pleasant. I just said it was simple and fast. So, how often should this screening be done? You should start having screening at age 21, regardless if you're sexually active or not. And that's a conversation, again, I do my disclaimer, that's a conversation that you need to have, again, with your doctor. And, if they're younger and you're still with, if they're 17, 18, they don't recommend it, but talk to your pediatrician. My job here is to educate you to the point that you feel comfortable asking questions and know that the questions that you're asking is actually relevant and makes sense. That's what I'm here to do, to empower you to take charge of your body. Because guess what? It's only one. I don't care. You can't go get a new tire that only works for cars. And it's hard. So take care of what you have. So women who are 21 to 29 should have a pap test. And then they talk about every 3 years. But let me tell you, honest truth, this change. Women who are 30 to 65, you have options. There are three options, but I am not going to list the options, right? Not listing the options because you need to talk with your doctor. Also, I put this picture up here as a reminder to let you know that there are different sizes for these speculum or for the speculum exam, and they're not all metal. They now have some disposable plastic ones that can also be used. I don't think it's any more comfortable, but, and they're different sizes. So talk to your doc about that, your gynecologist or your primary care physician or whomever it is. But if you're 30 to 65, you have some options. So this affects a lot of people, right? You're less than 65. If you're under 65, there's so much stuff that you need to be aware of and things that you need to do. So what are some of the possible symptoms? Truth be told, the dysplasia, which is like the early changes, there are no symptoms. There's none. And unfortunately, by the time you start to have symptoms, if you're having symptoms, that's telling us that the cancer is way advanced. It's just way advanced. And so you want to prevent that. When they do occur, sometimes it can be mistaken for other things. So if you're having abnormal bleeding, spotting, or watery discharge, bleeding after sexual intercourse, or painful intercourse, or pelvic pain, problem urinating, unintended weight loss, it's just a plethora of things. But what you want to do is to have that conversation. And if you've never had a pap smear, to ask your primary care or your provider, whomever it is, hey, I've never had screening for cervical cancer. Would now be a good time to do that? And some of you may have like an IUD in or other stuff. Still ask, right? Do I need to maybe still get checked? Right? So you don't want to have any symptoms. So make sure you talk to your primary care. All the recommendation and guidelines for when to have treatment, those change based on studies and statistics. All of that stuff change. So you want to make sure to talk to your doctor about the risk. What is your risk? When you should have screening, whether or not you have symptoms. Don't wait for the symptoms though. This is cervical cancer screening. You need to get screened. Now, when you're doing the exam, I have to mention this. I have to mention this. I'm not going to go into detail on it, but it's important for you to know. When you're getting the cervical exam done, after the speculum is removed and they try to press down, they're trying to feel for your ovary with the finger in the vagina and they're pushing off to the side. That's normal. And it's okay for you to look up um, what is included in a pelvic exam or when you're doing your pap smear, because they're not just doing a pap smear, they're going to also do other exams. Now, for patients who have cancer, when they do come to see us, before back in the day, now remember, I graduated medical school in 2003, so I can't believe it's been that long. But back in the day, when insurance would not approve for like MRIs and things like that, we had to do physical exam on our patients. And in order to find out let me go back. In order to find out if the cancer went back and into the anus, we'd have to do an anal exam along with like the vaginal exam, sort of like a scissor, to see if it's actually invading into the anal area. So the exam sometimes can seem to be a little bit invasive, but it's necessary only if it gets to that extent. And please ask your doctor, can you tell me before you do the exam what exactly you're going to do? So you don't jump up and slap, like, what are you doing? Take your hands from that area. It's okay to ask, right? Because you just lay there vulnerable, especially if it's a male. Also, you can ask for a chaperone. Hmm? You definitely have the right to ask for a chaperone. But if it's a male and you're uncomfortable, say, thank you, Dr. XYZ. I know you have to do this, but can you tell me step by step what it is you're going to do so I'm not caught off guard? Right? Because if you're there and you expect a speculum and then the finger goes in, just not just the vagina, but also in the anus, that could be a little bit much, right? So ask, please, 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 please talk to your doctor. And I have to say, thank y'all. I know this is why a lot of folks kind of come to me, because I just break it down. I'm real, y'all. I'm from the Caribbean. I didn't just go straight to medical school. I went through all of that, all Uncle Sam, all that stuff. So I can relate. I absolutely can relate. So ask your doctor. Come here, come here, come here. Talk to your doctor and ask these questions. Your doctor is there for you. I'm way over today, but that's okay. It's worth it. So today we went through so much. We went through a lot, and I thank you for staying all the way through. I didn't mean for it to go this long, but this is why I couldn't do uterine or endometrial cancer. It was just too much. And this was supposed to be 30 minutes. So we talk about what cervical cancer is. We talk about who's at risk. We talk about screening tests, symptoms, and so much more in between. And I hope you learned a lot. Let me know if you have any question, but I have a big bonus for you for those who stayed all the way to the end. And that is, did you know preventive and screening services can be $0 if you have Medicare? So if you have Part B Medicare, that covers the HPV. I went directly to the gov up here, Medicare.gov. The thing is, I realize that sometimes folks just don't know where to look. Right? So it's easy for me. This is what I do. I eat, breathe, sleep, this stuff. You guys, you don't know where to look. You don't know what to do. So these things are covered. So the Pap test, the HPV, all of that is covered. And last week, 2 weeks ago, I did colorectal cancer. Most of these are covered. Pause now. Don't go say, "Oh, Queen said it should be free." No, 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 no. Listen up. There's some of these tests that are covered 100%. So the screening colonoscopy, the fecal occult. If you weren't on for my colon cancer screening, go back on YouTube, go to the live section and go over that. Colonoscopy is the gold standard. But this is what I learned today by going on Medicare.gov. The colonoscopy and the screening flexible sigmoidoscopies are covered. But here's a tricky part. If you do a colonoscopy and they see a polyp and they remove the polyp, you have to do a copay. I think it's like 15 or 20%. So you have to know these things. The colonoscopy is free if you're good, but and there's some timing. I think it's like 24 months or 120 months, depending on if you're high risk or, So talk to your doctor. I'm not going to tell you everything, people. I love y'all too much to tell you everything. I got to give you some so you now can take and run with it. But Medicare cover a whole lot of screening tests and preventive tests, not just screening, but preventive. And you hang out with me every other Tuesday. I'll be popping up some of these, or you could go to Medicare.gov and find it on your own. But I want you to join me on a regular so that we could go over these things. So here we come now to the end, and I'm going to go back live. Oh my gosh, we covered so much. This was supposed to be 30 minutes, but y'all, Cervical cancer is a lot. Let's see what's going on over here. Thank you for joining. I see you, Rosemary White. Thank you for joining. Let's go down here. Um, Thank you for this information. You are most welcome. Most welcome. As always, I'm just here to share, to empower you. I don't want to be like, oh, well, I'm the greatest doctor. I'm only great because God has blessed me and the Holy Spirit tell me stuff all the time. So I don't be missing things because I stay humble and I pray. I'm like, God, help me so I can do this for the patient, etc. But sometimes people are not comfortable because of cultural reasons, religion reasons, etc. And I just want you to be able to have these conversations and not feel uncomfortable about it or not be marginalized because you're asking questions. And regardless if you are straight or gay or identify a different way, the care still, you still deserve the care you're supposed to get. So I want you to be able to feel empowered. This is your body, y'all. You can't go buy a new body. You can go get a new car, but you cannot go buy a new body. So I want you to take care of what you have because God has blessed you with it. And I am so very just humbled to be able to come from my humble beginnings in the Caribbean through enlisted, through lieutenant colonel, being a doctor, but God, to bring you this information on a regular basis. So, any questions, please let me know. I want you to not only go get your pap smear done, but reach out to somebody who you know who is under 65 and female and say, hey, you need to go get your pap smear done. And they say, well, what's that? Just have them watch this, go on YouTube, go live, and they can get information. I want you to please share even afterwards. And what if you had, thank you for that reminder. What if you had a hysterectomy? All right. So if you had a hysterectomy, thanks for the reminder. There are different types of hysterectomy. So there's simple hysterectomy and then there's full hysterectomy. And let me see if I can go back. When they do the hysterectomy, sometimes they leave the cervix behind. Mhm. So they could cut everything else up above it and they can leave the cervix behind. So if you still have the cervix and you had multiple partners or have HPV, the cervix there, as long as the organ is there, you're at risk. Let's put it that way. So you need to ask your gynecologist if you had a hysterectomy. Did I have a full hysterectomy, or do I, the ovaries are different. So the ovaries are different. The ovaries, yes, but the cervix is a different part. So let me see. I'm gonna have to go back. But if you remember, you go back and you look at the picture. The ovaries are out at the end here. It goes in, right, to where the uterus is, and at the bottom of the uterus is where the cervix. So they can remove the uterus and you still have the cervix left and they can leave the ovaries. So there's so many ways that they could do this. And that's why it's important to talk to your doctor and say, you know what, when you go to get an exam, say, look, I want you to do an exam on me because I had a hysterectomy and I don't know if I still have my cervix. Can you take a look and let me know? And then they will let you know if you need to be screened based on your age, risk factors, etc. All right. Well, look, I went over, y'all, and I had a long day. I am so tired. I sure am tired. I am so tired, and I know y'all had a long day too, but I want to say thank you for joining me. We went over a little bit because this was just good information and it affects a wide age range. Thank you so much for joining me. Thank you for your questions. And I look forward to see you on Sunday. I do MIMS at 6, making it make sense, where I do the same thing in the Bible and we're going through Psalm 91. And I will see you the second and the fourth Tuesday of every month at 7:30 Central, 8:30 Eastern. It's late, y'all. I'm going to get me some. Thank you, ma'am. Yes, I'm going to get me some much needed rest. And I got work early in the morning. As always, it's been fun. I am Dr. Williams, AKA Queen. Thank you so much for joining me. And until next time, you take care. May the Lord bless you and keep you and cause his face to shine upon you and bring you peace. And hey, Take care of your body. You only got one. Bye. Take care.